All right.
Can we start off, please? Thank you very much. I start again. I welcome you once again to this event, put together by NEXUS Across the Borders, an NGO in special consultative status with the United Nations ECOSOC, and the first NGO from Nigeria to be granted observer status with the UNFCCC since 2004. Today's event is being put together by NEXUS Across the Borders in collaboration with the Patna Group, the United Nations Foundation, the Environmental Defense Fund. Ladies and gentlemen, our side event tonight is linked to the UNOC 2025 Ocean Actions Panel 4, which is preventing and significantly reducing marine pollution of all kinds, in particular from land-based activities. As part of the stakeholders' declaration, the contributions by NEXUS Across the Borders was captured under items 63 and 64 of the stakeholders' inputs to the 2025 UN Ocean Declaration, key topics and recommendations online. Hence, we are all here today. The theme for our side event is Health and Climate Change, NEXUS in the Maritime and Blue Economic Strategic Policy Pathways for a Just Transition. To kickstart this event, let me provide an overview of all that we shall be doing here today. But before I do that, let me quickly recognize the following individuals for their role in making sure that this event became a reality. I'll start with our major partner, and that is Dr. Dolapo Oluteye, who is a senior researcher with the University College London, and also one of the leaders of the Patna Group. Dr. Dolapo, please. She is going to be moderating this event with me tonight. And this event is going to be in 3 parts. The 4th part will be introduction of guests and then taking some few keynotes. After which we'll move on to the 2nd part, and that is going to be a panel discussion that will involve about 5 key experts on the topic that we have here tonight. Dr. Dola will be handling that part of this program, and then the 3rd part will be the final part of the event. I'll come back to recap. But before then, please allow me to just mention in passing, because Dr. Dolapo will be doing a more introduction of all the speakers here tonight. I just want to mention, as I just mention your name, just please recognize with your hands up, Dr. Annika Frosch. Sorry, I don't want to spoil your name. Well. You're welcome, thank you very much. Dr. Domagoj, Baresic, thank you, you're welcome. I'm not going to say anything about you, just to mention your name, thank you. Miss Kerrlene, yeah, I've met you, thank you. Mrs. Marie Hubtova, thank you very much. Okay, Dr. Dolapo Oluteye, just for the record. And once again, my name is Pastor Peters Omoragbon. I am the Executive President of NEXUS Across the Borders and the first designated contact person for the UNFCCC from Nigeria since 2004. Tonight, I'll be giving my keynote address on this main topic. And the subtopic of my keynote address under the main topic of our theme tonight is healing our planet, healing our people, integrated policies for health, climate and ocean resilience. But before then, let me quickly recognize the Director, Research, Planning and Strategy of the Bayelsa State Marine and Blue Economy Ministry, all the way from the Niger Delta, Mr. Eric Wilkinson. You're welcome.
Thank you.
Introduction. The triad of planetary emergency and the convergence of crisis. Distinguished delegates, health professionals and custodians of our ocean. As a nurse with over 40 years in practice, both in Nigeria and the United Kingdom, who has resuscitated infants suffering from heat stroke in Nigeria's drought-stricken north, held children gasping from heat-aggravated asthma in Lagos, and consoled fisher folk from the Niger Delta, whose livelihoods vanished with collapsing fish stocks and whose nets emptied from coral bleaching. I stand before you not merely as a healthcare leader, but as an eyewitness to Africa's silent genocide and as a warrior in our planetary emergency. The interconnected crisis of climate breakdown, ocean collapse, and health system failure form a self-reinforcing vortex threatening 1.4 billion African lives. Today, noise across the borders and partners, with over 26 years of frontline climate change campaign and data from nations, confronts these interlinked emergencies with evidence, empathy, and exigency by the delivery of an evidence-based prescription for survival. Our diagnosis is unequivocal, and that is human health is oceanic health. Oceanic health is climate stability. When gas flares poisons children's lungs in the Niger Delta, those same toxins acidify the Gulf of Guinea. When rising seas flood Dakar slums, cholera follows. Yet our prognosis remains hopeful. Rigorous evidence confirms that strategically integrated policies can break this cycle. Let us dissect the pathology and implement the cure. African syndemic, the climate, ocean, and health in crisis. Climate health catastrophe, the data. Africa suffers about 4 to 7 times global mortality from climate-linked diseases, despite minimal emissions. Due vector-borne disease surge, malaria incidence in East African highlands rose 37% between 2010 to 2024 due to warming, reversed decades of progress, according to the WHO. Heat-related mortality, hospitalization for heat stroke in the Sahel nations increased by a whopping 214% since 2018, disproportionately affecting pregnant women and infants. That was Lancet in 2024. Nutritional collapse. Crop failures from erratic rainfalls elevated severe child wasting rates to 28.1% in the Horn of Africa, the highest globally, according to UNICEF 2025. The ocean health nexus, the unseen epidemic. Africa's marine ecosystem sustained 120 million people, now critically compromised. Fishery collapse. Fish stocks declined 40 to 60% along the West African coast since 2000, causing a 22% rise in child anemia in fishing communities, according to the Food and Agricultural Organization. Toxic seafood. Mercury levels in Ghanaian fish exceeded the WHO limit by 800%, causing developmental disability in 1/3 of coastal newborns. That was Ghana's Health Services in 2024. Professor Wisdom will be speaking more on that later on. Pathogen explosion. Viral bacterial infections increased 300% in Tanzania after coral die-offs disrupted natural water filtration, structural diagnosis, why health systems fail. This I'll look into through infrastructural paralysis and governance fragmentation. Data from NOIS Across the Borders 2024 Health Facility Survey through random sampling identifying 3 parameters on deficiency in facilities and human impact. We looked at 3 major areas. On deficiency, we looked at no backup power for vaccine. We discovered that 78% of the 12 African countries that were sampled had no power backup for vaccine. And what were the human impact? 2.1 million children lost immunization. No facilities for water purification affected 65% of the 12 hospitals of the 12 African nations sampled. What was the impact? Cholera case fatality rate rises to 18% during floods. Insufficient dialysis units affected 91% of the facilities sampled, and the human impact was 600,000 avoidable deaths from kidney failure during droughts. Governance fragmentation. There are 3 silo syndrome plaguing African policies. 1, Ministry of Health. What they do is to plan disease response after outbreaks. Then, about a week or 2 ago, there was this serious flood in Nigeria. Before then, the Nigeria Maritime Agency predicted there was going to be serious flooding and identified the areas to be affected. But no plan was made to mitigate the impact of this flooding. And at the end, what happened was that the government officials came to distribute foodstuff to the people affected by the flooding without adequate preparation to evacuate them from those areas before the flooding. Now, the Environmental Agency monitors chloral bleaching without head leakage. There is no connection between ministries. The Fisheries Department reports fish decline after stock collapse. In 2019, the cyclone Idai in Mozambique, Fisheries Ministry detected sewage contamination in shrimps harvest, but failed to alert the Health Ministry, and it resulted to 8,000 cholera cases. The Climate Agency predicted storm intensification, but did not warn the hospitals. 12 health facilities were destroyed. But let me just suppose this with Hurricane Sandy in 2012 in New York. But we all knew that when the 2 power generators that were powering the hospital broke down, what happened was that all the patients in that hospital were evacuated, 200 patients, and about 20 neonates in the intensive care units were all evacuated without one single death. That is the difference between what operates in developed countries and in developing countries. What are the policy pathways? Blueprints for integration. The Health Ocean Climate NEXUS framework. A binding protocol requiring 3 pillars. As part of our proposal tonight, we're looking at the binding a binding protocol that will require 3 pillars. Pillar 1 will be joint vulnerability assessment. How do we go about it? The methodology will include using WHO's Climate Vulnerability Index with the National Oceanic and Atmospheric Administration's Ocean Stress Indicator. How do we implement this? 1, this can be done by deploying 500 NORS-led field teams to map coastal water toxicity and child neurodevelopment outcomes, sea temperatures with diarrhea prevalence. Step 2 will include integrating data into the African Union's continental early warning system. How do we fund this? This can be funded from the G7 Climate Reparation Funds, targeting about $120 million per year. Pillar 2, cross-ministerial budgetary integration. We are proposing that the 3 line sectors, health, environment, and fishery, can each budget in the following order. Health can budget 45% of its budget allocation for health adaptation scorecard to track clinic resilience upgrades. The environment can budget about 30% for ocean health index to monitor coral cover and fish biomass. The fishery ministry could budget 25% of its budget allocation for protein security dashboard, that is, to mitigate child malnutrition rates in coastal zones. Are there records of this in the past? What are the sources model? Kenya's climate health hat in 2023. They redirected $47 million from oil permits to solar-powered health clinics by building 38 units. They also restored 6,200 hectares of mangrove, which reduced flooding to damage, which reduced flood damage to clinics by 70%. The second part will be the NOS deployed early warning architecture. The initiative in this will be 1, conducting training using the Climate Health Sentinel program, using the WHO model on certification that looks at ocean tourism, reproductive health, heat stress, etc., etc. Noise across the borders is partnered with the Colombian Global Consortium on Climate Change Education. Our partnership with this global institute is an advantage for us to provide the needed training and support for nurses and other health professionals if needed finances are provided for us to do this. Noise across the borders entered into a memorandum of understanding with the Federal Ministry of Health and Social Welfare in Nigeria on climate change campaign and to build the capacity of healthcare workers as frontline actors in mitigating the impact of climate change risk and disaster. Those across the border also entered into a memorandum of understanding with the Delta State government in the Niger Delta under the Delta State Oil Producing Areas Development Commission. The Niger Delta is the most devastated area within the Nigerian community, suffering from the oceanic explosion and then also the impact of climate change. We are also in collaboration with the Federal University of Petroleum Resources for Sustainable Development Center for Sustainable Development Center in Delta States. Noise across the borders and the global network of civil society organizations for disaster reduction puts us in a very strategic position in advancing this course. Now, if we succeed with this training, the plan and the goal is to deploy about 100,000 nurses by 2030, 1 per 5,000 coastal residents. What and how will they carry out this? We intend to use technology, working with the Climate Health Africa. We could look into developing a nurse link hub for real-time reporting of 1, fish kill events, which would trigger toxin screening, unusual rashes, which will also lead to tests for oceanic pathogens. Initiative 2, mobile ocean climate clinics. Design specification. We are proposing solar-powered vessels with desalination units, together with portable labs for heavy metal and plastic toxin screening. We also want to propose satellite-linked telemedicine for specialist consults. Pilot sites. We propose 2 countries in Africa, Nigeria, with the Niger Delta, screening about 500,000 fishers for hydrocarbon poisoning. And then we look at the Lake Victoria by monitoring the algal blooms linked to schistosomiasis outbreaks. 4. NEXUS Across the Borders 2025 to 2027 Action Plan. Scalable solutions. Phase 1. Rapid deployment between 2025 to 2026. Priority. African Marine Health Corridors. Geography. We are proposing 20-kilometer coastal zones in 12 high-risk nations. What are the interventions? Ecosystem restoration, nurse-supervised community planting of 1 million mangrove propagals, that is carbon sequestration plus storm surge barrier. Health infrastructure, flood-resistant clinics with rainwater harvesting of about 500,000 liter capacity. Telemedicine hubs for 1,000 exposure consults. Funding, the World Bank Blue Economy Bond with about $500 million can also be assessed. Fossil fuel accountability mechanism. This policy is modeled after the Nigerian Oil Pollution Health Levy 2024, where 7.5 tax on offshore oil profits amounting to $280 million per year for health adaptation fund. This fund mandates oil firms to provide pediatric cancer units in oil producing zones and seagrass restoration to absorb drilling off runoff. Phase 2, systemic transformation between 2026 and 2027. Initiative, Ocean Climate Risk Matrix by integration, by embedding national electronic health records through ocean triggers, automated health responses, and stakeholders. How? Ocean triggers, where there is an evidence of about sea temperature of more than 30 degrees centigrade for 5 days. Using the automated response, SMS alerts could be sent to asthma patients. Oral rehydration solution will be stockpiled. Who are the stakeholders for this? This could be done by nurses and meteorologists. Microplastic of more than 10,000 ppm. This will lead us to, through automated response, prenatal endocrine disruptor screening. The stakeholders here will be midwives and oceanographers. Coral bleaching, that is more than 50%. This, by automated health response, will lead to increased school meal programs with insect protein. Stakeholders here will be nutritionists and marine biologists. Initiative 2, Debt for Health Swaps. Cape Verde Agreement 2023. In the Portuguese government forgave Cape Verde their $150 million foreign debt by asking it to invest in environment and climate change fund, by increasing funds for nurse training on marine toxic emergencies, expansion of marine protected areas. So this can also be replicated in other countries with coastal crisis. Results of that: 40% reduction in diarrheal diseases from cleaner waters, 25% in fish biomass within 18 months. Financing justice, redirecting capital flows. A Robin Hood tax on ocean exploiters. We are proposing for the offshore oil gas sector a 5% profit levy, which could amount to $2.8 billion annually for health allocation to build solar clinics and nurse training. For commercial fishing, we are proposing a tax of $10 per ton by catch fee, which could amount to almost $600 million per annum, and that could help child nutrition programs. For the plastic production, we are proposing $0.02 per kg receipt charge, which could raise about $4.2 billion per annum for microplastic filtration for water supplies. Corporate liability enforcement. Legal precedent. The Niger Delta in Nigeria versus Shell in 2024. The court ordered the Shell to pay the Niger Delta community $1.9 billion for lifetime health care for 30,000 toxin exposed children, and restoration of 4,000 square kilometers of marine dead zones. The blueprint was after the AU's polluters pays protocol, requiring environmental impact bonds for extractive industries and independent earth damage assessments. NEXUS across the borders binding commitment for 2025 to 2027. We want to commit to 50,000 ocean climate earth diplomats using the WHO UNEP certified nurses deployed to coastal clinics. NEXUS Equity Index by annual ranking of nations on 1, their head budget integration percentage, coastal ecosystem recovery by hectares, climate disease mortality reduction. 3, we planning to have a 2026 million NOS match for global mobilization for the NIS Ocean Action Plan ratification. Conclusion. The NOS prescription for a living planet. When a nurse suction toxic algae from a child's lungs in Lake Victoria, then watch pharmaceutical waste choke that same lake, I see the hypocrisy of our fragmented systems. We stand at the precipice. When a child gasps from climate aggravated asthma, that is our emergency. When marine toxins poison a mother's breast milk, that too is our emergency. Nurses at the bridge between the intensive care units and the oceans. Nurses refuse this insanity. We are the antibodies in Earth's immune system. And I want to appreciate the presence of the various organizations here tonight that have agreed to work with us in this effort. Thank you for your time. God bless you. So,